Hi, I'm Marc Sklar, the Fertility Expert. This week, I'm going to share a list of 10 questions you need to ask your OBGYN or fertility doctor when you're trying to get pregnant. Remember, you can take control of your fertility, and knowledge is power. I want to help you understand what your body is telling you so you can work on getting pregnant faster. In this video, I teach you the 10 questions you need to ask your fertility doctor or OBGYN when you're trying to get pregnant. So many reproductive endocrinologists, otherwise known as fertility doctors, believe that you are visiting them because you want to do IVF. They can also make you feel like this is the only path for you, and if you don't do it ASAP, that your chances of getting pregnant will just continue to decrease in a few short months. Most of the time, that's really just not the case. That's why I think it's important to ask questions, and as many as you're comfortable with. The 10 questions you need to ask your fertility doctor are these. Number 1, what do you as a fertility specialist do? Let them explain what they do, how they work with patients, and what they believe their practice is about. I think we often take this for granted. Number 2, what are your success rates? Do you accept all patients that walk through your door? And how many IVF transfers on average does it take before I should expect to get pregnant? Success rates are important, but if someone only accepts a certain number of patients or a certain type of patient, that will skew their success rates. Number 3, what should people take into consideration when they first start seeing a fertility specialist? There's a lot of information out there and a lot of different tests, and it's really confusing, so let them explain that. 4, what concerns do you most often hear from patients who are just beginning treatment? Number 5, fertility treatments are often considered scary expensive. What financial considerations should you take into account? Do they even talk to you about finances? Because finances are a big part of this, and it's expensive. Number 6, are there any less invasive or more conservative treatments available? How do these compare with their recommended treatments in terms of risk and success rate? It's very easy for a doctor to just straight recommend IVF. What else can they recommend? How many cycles of treatment would you recommend before trying another option? So that's number 7. What else should you consider if these first options don't work out? Number 8, what is my prognosis? In your opinion, how likely is fertility treatments to be successful for me? Number 9, how do you feel about incorporating more natural treatments like acupuncture and nutrition? Clearly, I'm biased in this area, but you want someone who's going to give you options and be inclusive of other things. Number 10, what are the main lab tests or exams that you recommend that I have and why? Not only tell me the list of what I should have, but tell me why they believe it's important for me to have those done. It's important to understand that getting pregnant can be easy if you know how. And if you're spending time and money with a fertility specialist, he or she should know how to. So let them tell you. With my patients, both at the clinic and online, I follow a very specific protocol to discover the underlying causes of their fertility problems or problems. And if you're seeing me for help when you're trying to get pregnant or any other fertility specialist, you have the right to ask all the questions you need. I really hope this video helps you on your journey to getting pregnant. Subscribe here to get more information on our new videos and how to get pregnant faster.